So, what was the worst part of this experience so far? We're leaving John's 3-month follow up from his post surgery, Dr. Knudsen's office. How's it been going? Well, you got
Yeah,
you will want to do a
it's
post follow up, right?
yeah,
To the first
definitely.
video.
How's it been going? It's been a slow process, but I feel like that I am progressing. It's been a little bit less than 3 months. So physical therapy 3 times a week, and then on the days that I'm not physical therapy, doing exercises specifically to help get range of motion back. Um, I have
I
some.
can't see. Can you see?
I have.
Okay. Sorry.
I
So,
just did everything.
his shoulder looks awesome. It's he's been feeling this grinding when he lifts his arm, and Dr. Knudsen said that is totally normal.
It's the pyrocarbon cap that's on the end of the humerus, it's seating into the glenoid. Before I had the surgery, it was situated at the end of the glenoid because it was biconcave. So instead of like a half moon, it was two half moons, and it was sitting in the back. So he shaved all that bone down, and he said the pyrocarbon cap that's on the end of the bone, the humerus, is as hard as bone. So what it's doing is it's starting to essentially grind into that area to find the where it's supposed to be seated on his words, a normal human being.
Yeah. And so it's got to sit in that center of that socket again, and it's almost there, where
Yep.
before it was way freaking off. Um, and then, yeah, he's basically got what? So he's allowed to put his arm behind his back again.
Yep.
Um,
And I can't do anything weight bearing, so no push-ups, planks, anything like that. Still 4.5 months, so in a month and a half I can start doing that.
he told John that he's allowed to lift 15 pounds on his own. Is that what did he call it?
Yes, yeah, extended away from the body. And if I'm
Um,
gonna lift anything heavier, I need T-Rex arms close
yeah,
to the
and he
body.
doesn't want weight over. Not a lot of doing
Not a lot of repetitive motion
with his
overhead.
arm overhead.
Yeah.
So that's pretty much the directive, and we don't have to go back for 3 months. But yeah, he said John's making him look really good. He thought John would be weak in certain exercises he had him do, and he said, "Oh, maybe I shouldn't have spoke too soon because John's already got a pretty good amount of strength." But so,
Yeah, with external rotation, pushing against my arms just to see if you could push my arms in, up, stuff like that. So it was where my shoulder had been. I had lost a lot of musculature and muscle coordination in my back body, and I'm starting to actually, those are starting to fire again through the physical therapy. Um, and the woman that I go to is a very good physical therapist. I've been to physical therapy for other things, and they just send you through the motions. It really pays to get, if you have the capability to find a high level doctor and a good physical therapist, and shop around if you don't like them or don't feel that they're listening to you,
or you're not progressing as quickly as
it's,
you should be. Like, yeah, John's. But also, you have to put in the work. I mean,
oh, it's definitely,
yeah,
you have to push through the pain. I mean, it is painful. I'm not using anything for pain aspirin, nothing right now. But if I let the pain limit me, I I would be I wouldn't be gaining range of motion. So I know that as you push through that pain, that you gain that in those tiny increments of range of motion. So it's it's definitely worth it. But you just have to push through it, and you will see progress.
So, are you happy you got the surgery done
I
so far?
am so far. I'm happy. I'm not. Um, I would say 6 months. If I'm only 3 months into it. If he said that in the next 6 months I should see my range of motion increase and my pain dramatically decrease
and his strength increase
and my strength
and
increase.
he said, yeah, going upward from here.
Yeah, so I mean, if that's the case, I would 100% with the situation that I had and with my range of motion and the pain that I was in every day, I would, yes, all day long, I would get it again. But again, it's a slow process, and 6 months out of your life is dedicated to healing yourself.
Not here?
No, next one back. Yeah, Bronx River Parkway.
So, what was the worst part of this experience so far?
Having a talk on camera.
Totally.
What's the worst experience? I would say the anticipation. If I did not, if I didn't, I had Lyme disease last summer, and it really made me slow down. I had no choice, so I think that helped somewhat, because if I did not know, my tendency is to go all out on something, and you have to really let the healing, you have to work at it, but you have to let the process happen and let the healing happen. So instead of really pushing your will on it to get higher increments.
He was super patient with the 6 weeks in that sling. That would have driven me absolutely bananas. But he handled it all right.
Whoa, stay in your lane.
I know. Crazy. At least we'll have it on camera. Something happens. All right. So we also had John's other shoulder x-rayed today, because he does have some pain in there, get a baseline. So
yeah,
basically it's probably 10 years behind his other shoulder, right? I mean,
yes.
That's kind of
there's still space between the glenoid and the humerus, so I still have that range of motion. He said that he would start out with shots and then go to arthroscopic scraping and then replace it, but he wants it to be
10 plus
years down the road. The best thing that I can do is continue with range of motion, do yoga. It's the thing, as we age, it's
and not beat it up,
not repetitive. I mean, I'm obviously gonna still want to surf and do the things.
I think he's
talking
about really heavy weight bearing, repetitive, like sledgehammering type stuff. That's, what did he say? You don't want to be bench pressing cars.
Yeah, he said you don't want to become an Olympic weightlifter.
Yeah. which so far hasn't been your goal in life.
No,
One never
yeah,
knows, but
I'm
maybe.
I might get a hair up my ass, who knows?
All right, so what else is important for somebody who's considering it to think about?
Someone that wants to be physical and enjoy sports and physicality in general, know that you're going to be down. The lifesaver for me has been a stationary bike, because obviously I can't lean forward on the bike to ride it. Hiking and low intensity things like that, like hiking and sitting on the bike, have definitely helped. But know that it's going to take a solid 6 months, and all of that motivation that you have in the sports or the activities that you enjoy, you have to funnel it into recuperating and healing, and you have to put yourself first on that level. So know that if you really want it to the best outcome to happen, you need to really put yourself in the forefront and your recovery.
Helps to have a good woman too, no?
Yes, it helps to have a good woman, yes. Yes, it does. Because I won't take any credit for fixing myself, but I know somebody who will.
You know? If the shoe fits, you know? Yeah, wear it. What else I'm trying to think of what else could be like super helpful.
Taking responsibility for your recuperation.
Yeah, you have to go full out.
You can't expect a physical therapist to do the work for you. You have to find a good physical therapist, but you have to put that protocol that they give you into practice on a daily basis to get your range of motion and back into your strength. And somebody else is not going to heal you. Heal thyself.
Worth repeating one last time, like, get the best freaking surgeons and doctors and physical therapists and support people you can, because I can't say enough nice things about Dr. Knudsen. I mean, just a general really good guy too.
Very down to earth, and very confident, and
makes you feel confident going into it with him, and continues to build confidence even today. Like, it's just gonna get better and better and better, and just you can tell he genuinely cares, and he's good at what he does. Is there to answer every single question, but super efficient, and he's moving right on to something else too, and he's going to do just as good a job in the next patient he sees. So highly recommend him if you're in the, what do you call this, the tri-state area.
Yeah, he's in East
Chester, New York. Yeah, even you doing this is pretty amazing. They're almost even.
Yeah, I know.
I'm like, wow. And even he's like, lift over your head, they're equal.
They're getting there.
They're pretty darn equal. It was nice. I was impressed.
Yeah, I can't believe it's only been 3 months, and I have 3 more months. Mm-hmm. Well, a year. He said in a year is when it should be seeded fully.
Yeah,
but 6 months is when I can go back to
surfing and doing. Yeah, I mean, that'll help wear the groove for sure.
Definitely. I won't even be able to paddle out past the breakers, I'm sure. Human too.
Yeah, the whole team that you've had has been just stellar.
This is where, yeah, you have to, where we were fighting, swimming upstream, I feel like all of this has been pretty, feels like the old, the way things were
Because we
before
started
we did
making,
Atlanta.
remember what I said? It's like we started making decisions again and just moving forward. And the more you move forward, the more things move forward for you.
Yeah.
It's just like, I don't know. Moment.
Put your lips on mine. I love it when we hide in the pale blue sky, floating on cloud nine. Do you feel the winds are turning round? 'Cause what goes up must always come back down. I'll be safe in your arms, like the.
All right.
Yeah, he's just like, I like him, like, be a good human. You know what I mean?
Is that what he said?
Yeah, he said, be a good human.
On my side, I'll be fine.